in a diabetic person. So I'll be talking about the foot care in diabetes. Now, why do we need foot care in diabetes? Diabetes can damage the nerve and the blood vessels in the body. Initially, there's demyelination of the nerves, and first we have burning and pain in the leg and feet, and then we lose the sensation. And due to damage to the arteries and vascular structure, the blood circulation to the legs and feet become very poor. And once the blood stops in any area, that area becomes gangrenous. So we have to take good care of the feet because this is the area where the least blood supply is there. Next, please. Any infection in the foot and legs are difficult to heal. Diabetes can harm blood vessels, leading to diminished blood circulation in the feet, which in turn hampers the healing process. Diabetic neuropathy can cause sensations and numbness, as I've already told you. It can also cause tingling, pain in the feet, and burning sensation is also there. And if there's any wound, it is very difficult to heal the wound. If left untreated, infection from the feet can rapidly spread to the other areas of the body and cause exacerbation of the condition. Next. Now, we should understand the gangrene. The diabetes can increase the complication of foot infection if left untreated. It can lead to gangrene. Gangrene is a medical condition that supply stops in that particular part of the body, leading to the tissue death. Once the tissue is dead, it becomes a septic area and produces a lot of toxins which fit to the body and can even kill a person. The symptoms of this gangrene are swollen skin and feet, severe pain leading to loss of sensation, change in skin color, sores and blisters that release blood, fever because of the toxins, and loss of appetite because of the fever. If you experience any of these symptoms, visit your healthcare provider. Talk to your doctor immediately. Next. Understanding Charcot's foot. What is Charcot's foot? Diabetes can lead to the change in alter in the shape of the feet due to nerve damage. Charcot foot is a rare complication of diabetes-related neuropathy. Can rapidly spread foot infection. Complications and situation can also make the joints in the foot collapse, thus permanently hindering the ability to use the feet. What are the symptoms of the Charcot foot? It is foot pain, discoloration and redness in the feet. There is a swelling edema and warm feeling on the foot. If you have any of these symptoms, consult your doctor immediately. Next. Now, in a diabetic, the foot should be taken care daily. Daily foot care routine for diabetic individuals. What we suggest is that you add foot care to the diabetic management checklist. It is crucial to overall well-being. Following these easy tips to make proper care of your feet and manage diabetes effectively. Make it a habit to check your feet daily for any undetected wound or infection. You may have a small wound or infection, and because of the loss of sensation, you may not feel it. Wash your feet daily with warm water. Warm water, increases the blood circulation. Then apply lotion. Avoid the area between the toes. Elevate your feet and wriggle the toes several times a day so that it increases your blood circulation to your toes and feet. Always wear shoes and socks even inside to avoid injury. Cut nails straight with clippers to prevent ingrowth of toenails. Ingrowing toenails can cause a lot of damage and can infect your toes. The smooth edges with a Smooth the edges with your with a filer. Next, please. Now, the footwear is also very important. You should select your footwear very cautiously. Adding footwear to the diabetes management checklist is a crucial for overall well-being. Follow these easy tips to take proper care of your feet and manage diabetes effectively. Next, now what are the tips for selecting a friendly footwear? Buy comfortable shoes that provide support and cushioning for the feet. Do not use tight fitting shoes, not even loose fitting, because loose fitting rubs the feet a lot. Avoid tight fitting shoes and high heels and narrow shoes. Narrow means compressing your toes. Ensure that the shoes conform to the shape of the foot. If you have a large toe area, take a wide toe shoe and see that there's enough space inside. Consider buying shoes in the afternoon. In the afternoon, there's a maximum swelling on the feet so that you will have proper fitting shoes. Whether when breaking in a new shoe, wear them for a few hours daily hmm, so that they can be broken in. If you wear them continuously, they can lead to blisters. Choose a non-leather removal insole footwear. The insole which is there under your feet should be a non-leather and removable and soft. Next, now there's a lot of risk in walking barefoot for diabetic individuals. You can damage the skin of your feet. Walking barefoot on certain surfaces can cause foot burns, even the hot pavements and all, increasing the risk of diabetes foot disease. Remember these tips for effective diabetes management and foot complication preventions. Wear socks or stockings with your shoes to prevent them from getting blisters and sores. Wear socks made of material that pulls sweat away from your skin. That means it should be made of cotton. Don't wear socks with tight elastic bands. The tight elastic band compress your legs and prevent blood circulation. Wear shoes on the beach and hot pavements to prevent burns. Put sunscreen on the top of your feet. Next, now along with all the foot care, you have to manage your blood sugar levels. If the blood sugar levels are under control, the damages to your nerves and blood vessels can be reduced. Managing blood sugar is crucial for diabetes care. High levels can cause diabetic neuropathy, which should be avoided, a type of nerve damage. To prevent or reduce this risk, maintain blood sugar within the target range, fasting 80 to 120 and postprandial 120 to 180, and adapt a healthy lifestyle. Next, now what are the tips for preventing foot injuries? Avoid walking barefoot even indoors because you can strike any object and damage your skin. Perform daily checks for cuts, sores, and blisters on your feet. Wash your feet daily with warm water. Schedule regular screening and foot care appointments with your healthcare provider. Next, now recognizing the signs and symptoms of foot injury, keep an eye out for the following symptoms: tingling, burning, or pain in the feet, change in the shape of the feet over time, loss of hair on toes, feet, and lower legs. The loss of hair indicates poor blood circulation. Dry or cracked skin on your feet is a warning sign. Next, importance of regular foot examination. Now, unless until you check your feet regularly, you may miss some damage and that can lead to infection and gangrene. Regular screening and foot care appointments with your healthcare provider can prevent the onset or delay of the progression of the diabetic foot disease. Now, in this, the medical history is very important. Management of diabetes, any coexisting medical condition, symptoms present, medication prescribed, and type of footwear which should be worn. Dermatological assessment, healthcare provider will examine the feet skin for signs of dryness, cracking, calluses, blisters, and any other abnormalities or damages. The toenails for cracks and fungal infection. Fungal infection in the toes are very common. The temperature of the feet for uniformity. Musculoskeletal assessment is done by the healthcare provider. Will search for the issues like bent or overlapping toes, B unions, raucous shape on the bottom of the foot, Charcot's foot. In neurological assessment, these tests include microfilament, is a single filament which will tell you the sensation of the feet. Microfilament test touching fork and vibration perception. Threshold test, pinprick test, ankle reflex test. All these tests will be done by the and during neurological examination to see whether all the nerves and muscles and skin are intact or not. Next. Now, once you are going to travel, you should take these precautions. For people with diabetes, proper foot care is crucial, especially when traveling to prevent severe complications. Remember these simple measures while on the go. Consult your doctor about your trip and ask for the foot care advice while traveling. Break in stiff new shoes. Usually, we advise the subjects to take comfortable shoes which they are using for a long time. Don't start with new shoes. So break in the stiff new shoes before you leave for your trip to avoid foot irritation. Carry at least 2 pairs of shoes to switch often and prevent blisters and sores. Carry cotton or wool socks to keep moisture away from the feet. Prevent fungal infection. Pack a first aid kit to promptly treat foot sores and prevent infection. Avoid walking barefoot, whether in the beaches or the poolside. Next. Now, even pregnant women, those who are diabetic, should take care of their feet. Endocrine changes during pregnancy increases the elasticity of the foot ligaments, causing flat foot, potentially leading to a gradual foot arches collapse. Diabetes can cause insensitivity and foot deformities, often altering gait problems. Pregnant women with diabetes should take care of the following precautions to maintain foot health. Carefully wash and moisturize feet daily. Choose supportive cushions, shoes that fit well. Avoid tight footwear that crowd the toe. Refrain from using sharp tools and callous corns or warts. If you have any corn or wart, don't try to remove it in your own home. Next. Now, we should tell the patient that they should take care of their feet. We should empower them. Managing diabetes presents a significant challenge. However, during sensitive times like these, it is crucial to prioritize self-care and not become overwhelmed by the situation. Follow medication schedule regular healthcare appointments, and care for your feet diligently. Regular foot tracks or healthcare visits, along with annual comprehensive exam, can detect problem early. The earlier you detect, the better you'll be off. Wear proper footwear and never walk barefoot. Always wear socks with shoes. Manage your blood sugar levels, eat a healthy diet, and exercise regularly. When feeling overwhelmed, talk to your loved ones, friends, and family members. Next, foot care in monsoon. In the monsoon season, it becomes essential for diabetic individuals to take care of the following tips can keep your feet away from any risk of infection. Keep your feet clean and dry. Wear appropriate footwear to protect your feet from water and moisture. Inspect your feet daily for any cuts, sores, or blisters. Avoid walking barefoot. Moisturize your feet regularly to prevent dryness and cracking. Seek medical attention promptly for any foot issue or infection. Next, Walking barefoot in religious places. Now you visit a temple or any religious place, you have to remove your shoes and walk. Devotees typically remove their shoes as a gesture of respect when visiting religious places. But diabetic individuals are advised against walking barefoot, even within religious premises, to mitigate the risk of foot injuries. Alternative for diabetic devotees, options are therefore footwear made of cloth and soft material. Wear diabetic socks which provide comfort and reduce the risk of foot injury. Next, you can always join my virtual care clinic for diabetes. Thank you, everyone. Is there any questions from anyone? I'll be happy to take it.
Thank you so much, Doctor, for the wonderful session and guiding us through it. As Doctor said, if anyone have any questions, you can ask or you can drop your questions in the chat box as well. Meanwhile, I'll just take a moment to explain to you all how you can join Doctor's virtual care clinic. So you can either scan the QR code that is shown or you can download our Xyla application from the App Store or the Google Play Store. You need to enter the basic details along with the latest prescription and the unique doctor code shown in the bold capital letters. What are the benefits that you can avail? So we have the diabetes counseling, stress management tips, customized diet and exercise plan, 24/7 AI-enabled chatbot to address any of the lifestyle and medical related queries, and also the monthly education program that we conduct with Dr. Dange. You can join them virtually.
Okay, if there are no questions,
I
thank
guess
you,
not
Ankita.
any queries, so we can conclude this session. Thank you once again, Doctor, for joining us, and we all hope to see you soon with the next session. Till then, take care and have a good day ahead.
Thank you.
Thank you, Doctor. Thank you, participants,
Bye.
for joining. Please do fill the feedback form. Have a good day ahead, everyone.